want to tell a story about healthcare dollar spending. And if you don't care about how your healthcare dollars are spent, scroll on past. I'm okay with that. But this is a tale that I like to tell people when I talk about the ridiculous cost of healthcare, and how one of the things that I think is completely ridiculous is only in healthcare do patients not know the cost up front of things so that they can pick and choose. It's the whole purpose of capitalism, is being able to choose what's going to work best for you and your budget. And only in healthcare, at least that's the only place that I can think of it being, is that not the norm. All right, so I'm Dr. Leslie McElrath. I'm a board-certified family physician. I own a private practice in Akron, Ohio, where I do direct primary care. And because I do direct primary care, I care about your finances. So my story starts back, and I believe it was 2018, when President Obama came down with a ruling that said all hospital systems have to have on their website somewhere a list of services and labs that are frequently done and their prices, so that people can have transparency, right? And so I live in Akron, Ohio. I was starting my own business. I was like, this is really interesting to me. And so I did some research. Well, here's the thing. So I was able to find the information for Summa Health Systems completely by accident, because it was literally the RE of the word here in the middle of an entire paragraph explaining the new rule. And had I not been following with my mouse, I wouldn't have found it, but I did. It was there. I found it for Western Reserve Hospital, which is a physician-owned hospital system here in Akron, Ohio. And that was it, I believe. I was not able to find it anywhere on Cleveland Clinic's website. I know that it was on there somewhere because it was legally mandated. I just couldn't find it, right? And so when I'm looking through this list, they have the list of certain labs and certain imaging. And one of the things that stood out to me was the price of an MRI of the brain with and without contrast. That's one of the most expensive tests that you can get done, that people get done frequently. There are more expensive tests out there, but this is a common test that is done. And so at Western Reserve back in 2018, the cost of that test based upon this form said that it was around $10,000. It's probably more. I have it written down somewhere, but it was around $10,000. So you get that test done, you have to pay $10,000. Now, on that paperwork, it also said though that did not include the radiologist reading it. So it's $10,000 plus however much. They didn't tell you that part. Summa Health Systems, I found theirs for that same MRI of the brain with and without contrast. It was around $6,000. Again, does not include the radiologist read, but you know that it's $6,000. There's one other place that I found some payment information, but we're going to get to them in a second. So the reason that I do direct primary care and not do traditional insurance is because traditional insurance is kind of a racket. They pretend like they're helping you out by getting you lower prices, but they're all for-profit businesses. So they care about their shareholders. They don't really care too much intrinsically about helping you save money on things. And so what happens is, in the way that we've been brainwashed into thinking that health insurance is actually useful to us, is they'll see that bill from Summa and say $6,000. They can't charge you $6,000. You're with us. They can only charge you $3,000. See? Look what I did for you. Aren't you happy that you're giving me your money? So back to that other one that I found. Advantage Diagnostics is a standalone imaging service that's closest to the location to Akron is up in Beechwood, where they have MRIs and CTs and X-rays, and they have prices for if you have cash, right? Cash pay pricing. In 2018, the fee for doing an MRI of the brain with and without contrast at Advantage Diagnostics was $800. You walked in, you gave them $800, and you never heard from them again, because that $800 also covered the radiologist reading it. It was all included. Why? Because that's how inexpensive it can be. The reason that they can do that is because they're getting cash at the time of service. When you're waiting on an insurance company to pay you, you don't know if they've changed the rules recently and now they've decided they're not going to pay you, or the patient needed an emergency and so, well, you didn't get prior authorization, so we're not going to pay you. That raises the rate. Only in healthcare is that okay. In direct primary care, we are all about transparency. I'm all about making sure that you know how much things cost. Why? Because numbers are arbitrary. Like, we just kind of pull them out of our butt and say that this is what the value is. And if, society is willing to pay it, then that's what the value is. But your healthcare does not have to be ridiculously expensive. It doesn't. And so with a thought of trying something new, you have the opportunity to lower your healthcare costs, to actually have somebody that's in your back pocket. Because one of the things that I say all the time is that nobody wants to need a doctor. But when they need a doctor, they need one right now. How about having me in your back pocket so that when the right now comes, I'm there and available? Really learn about how your healthcare dollars are spent. Don't just assume that your insurance company or your job cares. Because maybe they don't. All right.